Hello, everyone. This is Eric Glazer, and welcome to Bright Spots in Healthcare, produced by Shared Purpose Connect. If you are new to the show, welcome to the family. We're excited to have you here. Each episode, we bring leaders like the ones you see in front of you if you're tuned in through Zoom or YouTube. We bring these leaders together to not only inform you, but also unearth bright spots, successes all across healthcare at plans, at provider organizations, at other healthcare solution and technology organizations, because our goal each and every episode is to identify as many bright spots as possible so that you can determine if the ideas shared during this episode can be applied at your organization. We believe that this strategy of finding a bright spot and cloning it is the most effective way to improve healthcare in our lifetime. We have an incredible group of guests that we've assembled here to talk to you today. We're going to talk about how health plans are revolutionizing the connected member experience. We have executives from the health plan of Joaquin, Cambia Health Solutions, BlueCross BlueShield of Tennessee, and Pager Health all here. I'm going to introduce them briefly in a moment. We're also going to put their full bios, which I will not read, in the show notes in your podcast app if you're listening via podcast. And if you're watching live via Zoom, we'll put a link to those bios in the chat so you can click on them and get a sense of the incredible expertise you're about to benefit from. Incidentally, if you have not subscribed to Bright Spots in Healthcare, I encourage you to do so. You get downloaded. A lot of the topics are evergreen. Leaders from across the industry sharing these success stories in different areas of healthcare. If you haven't subscribed, go to your favorite podcast app, type in Bright Spots in Healthcare, and you will be good to go. Recently, we had someone, and my producer probably didn't even, BlueCross BlueShield of Tennessee, not you, Sherri. Someone from BlueCross BlueShield of Tennessee said content and delivery was genuine and excellent. So if you actually really like the show, write a comment in Apple or Spotify. That way your peers in the industry are more likely to find the show and benefit from all those bright spots and help improve healthcare for all of us. Our sponsor today, incidentally, is Pager Health. They're a connected health platform company, and they enable the healthcare enterprises to deliver high engagement, intelligent health experiences for all consumers, patients, members, and the teams that you support through integrated technology, AI, and concierge services. Incidentally, I'm going to tell you a little bit more about them later on during the episode, but if you want to check them out now, if you're curious, pager.com. Super easy URL. I don't even need to spell it for you. Check them out. All right, let's get started. I'm going to introduce each one of our guests as I bring them into our discussion. I've organized today into sort of four segments. So if you're listening, those of you listening, you can follow along. We're going to start quickly with strategy and culture, just to set the stage around consumer centricity. We're then going to get into data and decision making, which is a meat of the topic that we're planning for you today. And then we're going to double click into personalization, which I know a lot of you want to learn more about and what these organizations are doing. And then finally, and maybe even most importantly, the end result, getting individuals to the right care at the right point of time. We'll cover that in the last segment of today's episode. I'm going to do something cool too. Each episode, we always send out a survey to you at about 45 minutes past the hour so we could get your feedback for you live attendees. We want your feedback on what topics we should cover throughout the rest of the year in 2025 and just how we could be better. And we read each one of those. And incidentally, I read each one of those. What I'll do for anyone that fills that out, and we'll remind you one more time before the show's over, I'm going to give you my notes. They're not great, but I took a lot of notes to prepare for the show. I'm going to be taking notes during the show. And if you guys want notes that help summarize some of the topics covered today and some of the insights covered today, I will send those to you as a thank you for filling out that 2-minute feedback form on SurveyMonkey. All right, let's get started with strategy and culture. And for that, I'm going to bring in Laurent Rotival. He is the Executive Vice President and Chief Information Officer at Cambia Health Services. So, Laurent, thank you for kind of getting up early for us. And before we get into the tactics, I want to talk, like I said, about strategy and culture, because I don't think you could have a true consumer-centric strategy without having a true consumer-centric culture, and that's hard to do. So could you tell us a little bit about how Cambia is driving that culture and driving that overall consumer-centric strategy.
No, thank you. And Eric, really great to be here this morning. And thankfully it's not that early, so I can handle it. So Cambia, first of all, is a group of BlueCross BlueShield plants in the Pacific Northwest. So we are come under the brand of Regions BlueCross BlueShield, and we operate in Washington, Oregon, Idaho, and Utah. So good and close friends of Sherri and the team in Tennessee as well. First and foremost, I mean, health plans are complex organizations, and obviously on the payer side or the financial element of the member's experience in healthcare. But what's critically important for us is always to be anchored in who we're serving. And who we're serving is not just a member, an individual who goes from open enrollment to open enrollment, but or somebody who has an identity as the employee of an employer, or a patient that has episodic interactions with their providers, but it's really a human being that has a whole life, that lives in a community, that has, families, members, and so on. And we seek to serve that person, right? And as I think many people in the audience probably know, I mean, in healthcare, we tend not to define people that way, right? We define them as members, we define them as patients, we define them as employees, and we seek really to think about holistically of that individual. And as we do that, that drives the culture, right? Cambia is all about, delivering a more person-focused care, helping to orchestrate the experience of individuals, and making sure that ultimately their lives are better.
I love that. Could you share any sort of tactics internally or programs internally that you guys leverage or put into place to kind of further build upon this focus of the person is not just a member or a patient or an employee, but there's someone that lives in the community, and how like you get your leadership to actually absorb kind of this mentality?
So when I'm approaching my 9th anniversary at Cambia, and one of the things I love about the company is that regardless of the topic we're discussing as a team, whether it's at the executive level or at any one of the projects and operations, is we anchor our meetings in the member experience, right? And the individual has a different way of thinking about their healthcare, their needs, and what they need to help themselves. And so we listen to calls. We have recordings, of course, like all of our peers, of customer service calls, and we start our meetings, whether it's at the most senior level at board meetings, whether it's executive meetings, whether it's working sessions, and we just listen to one or two calls, right? And it's amazing how, independent of the topic we're there for, being able to listen to somebody speak to one of our customer service professionals, many times listening to their clear anxiety, the stress, the difficulty they have to get the answers they need or to find the care they need, their inability to understand their benefits, the anxiety that comes about whether they're going to be able to pay or have the transparency to understand what the payments are. And so what's fascinating about that is that we listen to these calls, and it's really difficult not to take them personally, right? And to be affected, right, by sort of these very difficult situations that people are going through. And so as we listen to these calls, we immediately jump into whether it's a technology topic or an operational topic or a financial topic, and we're anchored in the emotion and the state of the individuals that we just heard. And I find that it kind of brings your culture to the moment, to the present, and you become sort of mindful of that, right, in whatever topic you discuss. And that has a big impact for us.
I love that. I love that. I love hearing about that. I don't think enough of us in the industry and enough of our organizations do that. I think that's a great way of sort of understanding directly from their point of view what it's like being an individual calling in. I want to shift over now to like making sure that we are thinking about personalization now, but using data and actual insights to do that. So I want to start with data and decision making. And so I'm going to bring in Sherri Zink. She's the Senior Vice President, Chief Data and Engagement Officer at BlueCross BlueShield of Tennessee. So Sherri, welcome aboard here. And can you tell us a little bit about how you guys are approaching this and what maybe some of the results have been?
Yeah, and kind of just to reiterate what Laurent was saying about a person being, a member, they're a patient, they're an individual in the community, and to really understand, that personalization of an individual, you really have to bring in lots of different types of data. So when we think about a member, we're looking at claims information. When we think about a patient, we're working with providers from a clinical perspective. But then the other important thing is what kind of community do they live in, and what are those social drivers of health that may be impacting their ability to either access care or actually be able to deliver on maybe an outreach that we may have with that individual. And so some ways that we're leveraging that, and again, if you've just got the data, you've just got the data, right? You need to be able to apply that data and have some actionable insights around it to be able to work with those individuals in a personalized way. And so one of the ways that we have done that is we have taken all of that information and created some different types of risk scores. One of those is more of a clinical type risk score, where we're looking at what is the disease burden that particular individual may have, and where are the opportunities that we have to help them along that continuum of care. The second area is also those social risk factors, because it's very important to remove barriers to care so that someone can actually be on that healthcare journey and can actually achieve that personalized experience. But one of the other things I think that we have also done to leverage that data and give insights to our team across the company is looking at the impactability and where there's an opportunity to leverage that information for impact. And what I mean by that is each one of us are individual, and the way that we may respond to things is very different. We have our own persona. Some of us are cost conscious, some of us are caretakers, etc. And so it's very important to understand how we like to be communicated with. So the combination of these different types of scoring and impactability gives us that insight into the whole person, as Laurent talked about, and what is that right outreach strategy for that individual, and where do we need to get involved to kind of move along or remove a barrier of care if they have a social issue, and allows us to kind of segment that population. One of the things that this has really helped us with is clearly define where we need to get involved from an outreach perspective. So opening up this data to all of our constituents across the company, whether that be our providers that we're working with, the customer service agents, or the clinical team that's leveraging this information. And it really helps us to move that person along that continuum and to maybe speak to them differently. As we've started to implement this process across the organization, we have seen increases in our engagement rates of about 30%, because again, we're opening up this information to a broad audience within our organization and even outside of our organization. And we're also linking it with some of our community partners. I think the second thing that we've seen is a lot of times we are working with individuals to help them close gaps in care so they have a better quality of life, or if we can maybe keep them from moving to a worse disease state. And by doing that and including all this information and helping our teams understand what is that right next best action to take, we've been able to kind of improve closures and gaps in care by about 20% across the organization. So we are seeing that this personalized approach it has a meaningful impact on the community and the members that we serve.
Wow, I love that. Let me just repeat some of that back, just make sure I captured it correctly. So you really have, I'm going to call it three components to this. You have your clinical risk score, your social risk score, and then you have the impactability score, which is looking at these things and the likelihood that an individual is going to react to outreach and how they would. And that allows you to get much more personal in your communication and who to outreach to and when to outreach to them.
That's correct.
And so far through that effort, which seems like a big lift, and we'll get maybe into more of how you did that later on, but 30 to 40% increase in engagement. Not surprising if you could pull it off. 20% improvement in gaps in care, give or take, which of course is going to translate into some sort of total cost of care reduction, but we won't even get into that. That's probably a safe bet. Did I capture all of that correct for those?
That is correct. Yes.
My notes are good. All right, great. I want to, if it's okay, I want to now get into personalization. and bring in Rita Sharma. She's the Chief Product Officer at Pager Health. And Rita, so we've outlined culture and we've begun to now talk about data and personalization. Can you provide an example of how a health plan maybe is using a data capture agent like an HRA to create a personalized member journey for each one of the individuals that make up a patient population?
Yes, I think from a member and payers perspective, the power of data really lies in personalization. That's the whole goal of it. And so I'm going to share an example of a Blues health plan that's serving about 3 million members in the Southeast. They were struggling with maintaining high star ratings. And so Pager Health partnered with them to create a tailored program, which was really around the dynamic CMS requirements. And so this featured custom health assessments, email campaigns, self-guided journeys that were personalized based on the data, of course, that was gathered through their health assessments and any other data we had around that member. And then rewards and incentives. There was also this element of coaching, but the coaches were armed with the data around that member. So with this, they were able to deliver very high engagement, care gap closure, member satisfaction. Those were their goals. And again, their ultimate goal was at the stars rating level, they wanted to be able to get better results. So what they were able to do is get a 128% increase in care gap closure, a 96% member satisfaction, which is amazing, a 94% first call resolution rate. They went from 4 stars to 4.5 stars in 2022. Then they went to 5 stars in 2023. And so I think what makes it different for personalization based on data and AI is just creating that experience of one. How do we create an experience of one? And so within this population and based on this data, we were able to connect members to MSK resources that were available through this pair, or in other cases, drive them to colorectal screenings. We can't know, but what a member needs. And so the N of one is the consumer's expectation today. And in healthcare, we must deliver that at scale. And that I think is what's exciting about some of the innovations that are happening today.
Wow, I love that. I want to just outline, because those were some staggering results you just threw out there, Sue. And I love it how like I'm hearing consistency amongst everyone's answers right now. So you built an HRA, then the health plan would maybe your support help stratify that population. You created these self-guided journeys, and with a focus on that N of one. And at the end of the day, the results were, and I may get some of this off, so that's why Rita, I want to repeat it back, make sure I get it. 96% patient sat, 94% resolution rate. Was it 128% increase in engagement? Is that what I heard?
Yes, in increasing care gap closure. Yeah.
Oh, care gap closure. Sorry. And then where the big bucks are for those listening is over a 2-year period, they went from 4 to 5 stars. Or was it 3.5 to 5 stars? 4 to 5?
4 to 5. 4 to 5.
That's pretty powerful. That's great. I love that. Just I usually do this later on in the show, but just so everyone has some context when we're hearing Rita share stories, and she's got a lot of great ones. I just want to give you some context and tell you a little bit more about Pager Health. We're always we've been producing this show since 2014, and we wouldn't be able to do it without these organizations that support the show, but not only providing incredible guidance and bright spots for all of you, but also, to be clear, funding for the show. Pager Health has been unbelievable to work with. So if you haven't heard about them, I just want to give you some more details on who they are and how they could help. They don't focus on symptom management or treating immediate medical needs per se. They take a more holistic view and help you guys. And I know everyone's thinking about holistic care. They take a holistic view on an individual's health profile and the longitudinal journey, and specializes in, as you could hear it from just that story Rita just told, personalized services through the entire individual's journey. And this leads to greater outcomes, as you just heard, including follow-ups to appointments, which is often overlooked. We all know that. Reducing costs overall, and of course, increasing the individual consumer satisfaction. They do this by providing fully configurable solutions, tech support that is AI enabled, digital tools, and concierge services to help the navigation for people for your health plan team, your provider organization team, or your self-insured employer team in your journey to try to optimize and expand integrated models more effectively for the people that you serve. So I'll leave you with this. They focus, as far as KPIs, on readmissions, reducing readmissions, especially in the ED, accelerating medication adherence, accessing behavioral health when you need it, and closing gaps in care, as Rita just demonstrated in that story. When I was preparing for the show, they sent me a white paper, and it outlines another case study, some of the key details in how to execute and some of the results. So if I'm thinking about a PowerPoint presentation for the executive team, or I'm thinking about a business plan and I need some stuff, I would grab this white paper, especially pages 3, 4, and 5. Have the details on it. It's called Highly Engaged, Unleashing the Power of Connected Healthcare Experiences. And if you want a copy of that, you don't want to find it on the web or go through like a gate, I'll email it to you personally after the show. We'll have our production team just throw that up there. And anyone that wants it, I'll send you a copy of it. Like I said, pages 3, 4, and 5 are jam-packed with details to help you with all that information. And if you, just so you know, like these guys are not new. Like they've been helping payers, providers, and employers for a while, and they represent 28 million individuals across the U.S. and Latin America. So they've got a lot of chops, and we'd like to thank them again for supporting Bright Spots in Healthcare. I want to now go back to the West Coast and bring in the Chief Information Officer at the Health Plan of Joaquin, Victoria Worthy. And Victoria, personalization cannot be truly personalization and can't be effective if you're not sharing the data downstream, right? There was some I think it was Sherri or Rita alluded to sort of community resources. Well, how does a health plan effectively share data downstream to CBO partners who are so critical in the member journey and so critical in mitigating social drivers and providing wellness services and overall reducing your total cost of care?
Yeah, thank you, Eric. I think that's where we're going to get into digging a little bit deeper here into the data. So as many of others have said, personalization is really important to providing the whole person care. And the people that we serve at Health Plan of San Joaquin and Mountain Valley Health Plan are Medicaid population. And so they do have some very, we'll call them layered dimensions to their lives. And we're, transportation, it's not just clinical anymore. We have transportation needs, food needs, shelter needs. And as many of you all are dealing with in your states, mental health. So, not just looking at the physical care anymore, but looking at that whole person care. So for us in California, similar to other states, California is midway through a 5-year strategic plan at the state level called CalAIM. And really what that leads into is the 1115 waiver and being able to provide more whole person care to the people that we serve in our communities. And that is inclusive of our community-based organizations, our county partners, the WIC programs, the welfare programs. And so what we have done is, the first 3 years of exchanging data has been very difficult. Obviously, our CBOs were not prepared to be able to render those services to the great populations of California so quickly and overnight. And so we started out with Excel spreadsheets. And as many of you know, Excel spreadsheets are very manual, they're difficult, they're not real time. And so we were having difficulties with sharing that data so that data was in the hands of the people that really needed to serve our members and our population that we serve. So over this last year, we've actually partnered with our HIE to develop a platform that we can not only just share that clinical data, but also have a single point of data collection for data for both clinical and social services data. So with our CBOs, our county departments, those being the WIC, the local health department, et cetera, now have a way to share that data that help us complete the picture for our members. And that can be anywhere of, being enrolled in a WIC program or being enrolled in welfare. And we're able to see that information to then, to Sherri's point earlier, stratify them from the social determinants of health, their clinical picture, and combine that together to say, how do we serve this member and these people at a greater level to help support them?
Do you have a specific example in mind, Victoria, that you could share?
Yes, absolutely. So if we take an example, a member that we'll call her, Sherri, and Sherri is, needs to go to a doctor's visit, but Sherri is also homeless, and so she needs coordination for transportation to that doctor's appointment. She also needs coordination of scheduling that appointment. She needs transportation to maybe pick up her prescription after and then back home. So that coordination of clinical social services, as well as meeting the needs of the member, all of that gets pulled together, and we're able to provide that care and that holistic services to our members to track from both clinical and social services perspective. That data then gets published more real time to our CBOs, where they're able to support the care of our member real time. So they're in the office, and our member is talking to the physician, and they need to get that transportation. They're able to coordinate that real time for them. So that's the power of having that data real time and not having to wait or be on hold to get a ride, or maybe Sherri doesn't have a cell phone to call Lyft, or doesn't have a car to get to the next place. So that continuum of care is really reflected in our ability to provide that data to our CBO partners, provider partners, and our county departments.
Great. And what platform are you guys using?
So we're using Manifest as our HIE, and then also for our closed loop referral system, we use a platform that's hosted by Omega.
I have a question. Thank you for that, Victoria. And I have a follow-up question for you, Rita, and you could jump in, Sherri. So for determining like that personalization and that customer segmentation, that people segmentation, like what types of data are being used, and what type of analysis are you guys employing? I'll start with you, Rita, and then we'll shift over to Sherri if you want to jump on top of that.
I think what we're finding is usually using that claims data plus any self-reported data, so call it health assessment data, some cases remote monitoring. There's an ability to bring in a lot of data sources to create data risk stratification for a population. So we're seeing approaches that are very different from payer to payer. And generally our position is we want to partner with our payer partners to figure out what populations they want to address and how they want to address it. That's what I'm seeing in the market today.
Sherri?
Yeah, and from my perspective, I mean, we're leveraging a lot of different data sources and some algorithms. So, for example, we leverage some third-party data that really gives us insight into where someone may have a social driver of health, whether that's a food insecurity or access to care, or maybe even economic stability, maybe based on the community that they live in, or a census report, et cetera, that may have been filed. We also have several algorithms that we look at to see how someone may react to a particular outreach that we have. And we track what really maybe works with that person versus not, so that we can shift the way that we might communicate, whether that be an omni-channel delivery or either digital, or maybe they want to be in person. We find a lot of our Medicare Advantage folks actually react better if we talk to them in person versus sending them something, via mail or that type of thing. They just want to talk to somebody. And so I think a lot of that is leveraged to determine what really is important to that particular individual, not only from a health perspective, but just also from just social issues that they may be dealing with, and then how they really react to any other interaction that we have with them, and how do we continue to hone that and personalize it and individualize it.
It's great. And I want to stay on this topic still, personalization, for a little bit longer. Laurent, I want to bring you back in here. Obviously being able to personalize and then take whatever data you have to support like how you engage someone in a personal level is the key. So maybe you could share with us how Cambia is engaging an individual up close and personal, and maybe even provide an example for us.
Yeah, no. So first of all, it's so energizing to listen to my colleagues talk about the programs they're doing. I mean, I think this is, as complex as healthcare is for the people we serve, it's really impressive and exciting to see what's going on everywhere in this country. Cambia, as we looked at how to engage with our members, we started looking outside of healthcare because there really wasn't a lot of very inspiring examples. I mean, this was 8, 9, 10 years ago. And so we started looking at what do we all enjoy so much in our experiences outside of healthcare, whether it's retail or transportation, or digital first mobile experiences with banking. And we started thinking, well, how do we recreate that? How do we bring that to healthcare? And so what we did is, rather than, which we had done in the past, building on top of our claims platform and our very large, sort of processing platforms, we decided to create both in-house as well as in partnership with companies like Pager, is to create sort of a cloud-first, retail-inspired platform, right? Where not only it was the hosting platform for all of our digital experiences and our, human augmented experiences, but also became the center of our enterprise. Because as we looked at, how do we create these rich experiences with this incredible variety of services, which in some cases are provided by our internal resources, but in many cases are provided by highly specialized point solution companies or point services. We decided, well, we've got to create a platform that gives us that flexibility. And so we built and established this digital cloud native hub, all based on open standards, which has allowed us to not only make it very easy to plug and play with third-party partners, whether it's for pharmacy, whether it's for chronic disease, whether it's for medications, whether it's for any other type of service, but it's also allowed us, perhaps even more importantly, to kind of develop a user experience, a fully integrated, seamless user experience for the members that kind of mirrors their own individual mental model. And people don't structure their healthcare experience on the way a payer is structured, or the way a provider is structured, or the way any kind of technology company is structured. They have their own mental model. And what we've done is
that what you meant by the retail? You said
Right.
the best retail experience in replicating. Is that what you meant?
That's right. So we looked at what is intuitive to them and how do we create that kind of agility so that we can take the best of healthcare, both in the context of the incumbency of a payer, but also of this incredible digital health ecosystem, right, that we evolve in and tap into. But how do we make sure that we present all this and integrate it in a way that we can provide those services seamlessly, but also make it intuitive at an experiential level? And so, for example, I'll talk about pharmacy for a moment. There's a group that we've been working with for many years to develop, a full real-time medication and pharmacy service, right? That is both digital first and available in a seamless, intuitive way through our mobile and web experience, but at the same time gives you access to a pharmacist, right, in real time through that digital experience. And so that, as you evolve into our application, you can see a real time, you can manage your own personal medication cabinet. You have real-time reviews of how medications interact. You have real-time alerts based on, your adherence to a medication protocol. You have real-time research to suggestions on efficacy and cost of potential alternatives, right? Not only from the context of an individual drug, but also how that drug interacts with all the other meds you have. And as you go through these different resources, you can also just immediately reach out and chat with a pharmacist or potentially speak to a pharmacist. And so that has given us a tremendous opportunity, right, to sort of compose and bring all the services to the individual in a low friction retail kind of style.
Yeah, that's brilliant. I love hearing that. I want to stay with personalization for another moment. Then we're going to get into right care, right time. For those of you that still have questions, throw them in the Q&A module. We'll do our best to write some answers. We're tight on time here, but throw them in, and we'll do our best to incorporate them. I've got some questions coming down the pike that I think we could integrate some of the questions that are outstanding right now into our conversation. Rita, actually, before we get started, when you're thinking, you've heard Pager be mentioned a couple of times. I don't want to kind of make this into a commercial, but if you want to get an understanding, if you guys don't have deep expertise in personalization, or just get an overall understanding on how to combine digital and AI-enabled digital with concierge service for navigation and to provide holistic care, I would encourage you guys to just network with Pager. You know, you don't need to buy their services just yet, but certainly learn from Rita and her team. And if you want me to introduce you to someone, just have a networking call to learn a little more about some of the cool things they're doing across the country with the different health plans. I'm happy to make that introduction individually, so that you don't get necessarily cold called by people, but you get an email from me introducing you. So if you want to meet with those folks, why don't you click on that poll and I'll make a personal introduction to the folks at Pager for you. Rita, like, how are health plans taking advantage of the different member access and communication points, right? Can you provide an example of how that's happening? How a plan may be, using communications in a customized, personalized way, and in doing so, reducing total cost of care down the road?
Yeah, no, there's so many great examples. I think it's amazing to hear Laurent talk about experience, right? So our experience anywhere is our expectation everywhere. And I think that is how members are now showing up at healthcare and saying, how does my experience look like all the other experiences that I'm having that are pretty convenient? So it's very cool to see that being utilized across this industry. I'm going to share an example of a Blues health plan that's serving about 4 million members in the Mid-Atlantic. And what they really were going after is, how do we improve health outcomes, reduce our costs, and really enhance that member satisfaction, which are pretty much the goals from many health plans in the US and across. And so the plan leveraged Pager Health's 24/7 nurse triage, the aftercare follow-up, appointment scheduling, so some of our key solutions to offer this very personalized and convenient support. And really, firstly, to improve access. That was the first step and the first thing that was achieved. And then this contributed to getting treatment compliance, closing care gaps, and ultimately leading to health outcomes that were minimizing unnecessary costs in the system. What we saw was a result of about $211 in savings per encounter through clinical care navigation and the steerage, a 25% reduction in care costs because of all the robust aftercare follow-up that was happening. So an incredible amount of savings across the whole system, and an NPS score of 90. And I will talk about NPS all day long because I think it is the most important way to think about ourselves in healthcare. That's the way retail thinks about itself, to Laurent's earlier point. I'm going to share a personal example, a personal being with one of our members. We had a 75-year-old woman that called in. She had a mental health crisis. She called into Pager Health's nurse line, and she was desperately in need of support. Really, she was having suicidal ideation thoughts. But what was driving all of this is she was the sole caregiver for her husband with stage 4 cancer. With his advanced age and frailty and her own, she was struggling to provide care that he needed, and she was unable to really do that self-care to meet her own needs. And so there was an overwhelming undertaking for this woman to get past all of the issues, but she was really contemplating doing some very dramatic things, maybe taking her husband's pills to lead to, really just starting thinking about suicide very deeply. And so where Pager Health stepped in, I was able to offer empathetic, meaningful support, providing her immediate access to mental health services, and then also giving her caregiver support, right? It's a big burden to be taking care of someone, a loved one, to start to get to the root cause of the crisis. And so the coordinators and the navigators helped connect with a discharge plan for her husband, remedied this gap in care and all the other issues with her husband, and then connected her to the right solutions to be able to get the mental health resources that she needed for her care and also for the care of her loved one. So I think that we can talk about population, we can talk about data, but I think really the power of personalization is being able to impact in a very personal way people that are in need and struggling and coming through the system.
Yeah, amen. I just that Mid-Atlantic plan, I love how you shared that individual story, and I'm sure that's multiplied over X amount of times to create the results you did for that health plan. I just want to confirm I heard those results correctly. You had a 66% resolution rate and a $25 per encounter reduction in total cost of care. Did I hear that correctly?
$211.
All right, 200. See, I just shortchanged you big time. Okay, and what NPS was? Did you say the NPS 90? Was it?
Indeed, yes. Yeah.
Great, thanks. I just want to great stuff. I want to, when we're thinking about Medicaid, and I want to bring back in Victoria Worthy. Victoria, like, how does a leading Medicaid plan like you guys ensure a positive consumer experience while also ensuring that the referrals that you're making are adhered to in what I would say is probably a pretty challenging population? And then a shout out to Christine out in our audience. I think this will cover your question you have in the module. If it doesn't, let me know. Go ahead, Victoria.
Yeah, so I think, for us, it's going back to the data sharing and making sure that everyone that is a part of the continuum of providing that whole person care has the data at their fingertips. So having, a closed loop referral system, it's a hot topic in California right now of implementing that. And really what that means is, we often have authorizations that, or services that don't require auth, or we have social services that are not billable services, such as being able to coordinate transportation for a member or coordinate an appointment for a member. Those are typically not reimbursable in the Medicaid space or Medi-Cal space. So, we use that system on the front end to give access to that data in a more real-time format, so that when the member is going through their journey, their experience, and going back to the example I used of, someone having to get transportation to an appointment, then the booking of the appointment, then the ride home, and then the ride to pick up a prescription, that data is at the fingertips of those individuals coordinating that care. And that is the most important experience for us, is alleviating that stress that Laurent talked about when they call in. If they have to call 15 different agencies or 10 different agencies to get the care that they need, they're going to give up, right? And we see that very often in our rural counties and our Medicaid population, because it becomes just so challenging to get care sometimes. For myself, I know the healthcare system, right? And it's sometimes even challenging for myself. So an individual that may not have the resources at their fingertips, we want to provide those resources. And we do that through our technology and our data, and through that integration and that full continuum of care. Having that access to that data is the most critical for us.
Another closed loop referral system bright spot. I like that. Speaking of right care, right time still, Laurent, like, to tell me a little bit about how you guys are doing that and getting folks at the right time to the right care.
Yeah, I'm listening to Victoria's comments, and she's so right. It's and preventing, the people we serve from abandoning or giving up, right? I mean, it's so easy to give up because it's so complex. We touch on pager a lot, and I mentioned that they're an integral part of our member engagement and personalization strategy. One of the things that has worked out well for us is, how do we hide that complexity? How do we put it back? And how do we help the people we serve, well, to be matched with what they need and to have all the other stuff that they don't need? And you could argue it's 99.9% at any one particular interaction point that they shouldn't see or be seen. What we have done is we've used Pager's nurse service right there behind our digital experience, whether it's web enabled or mobile. And so as our members engage with us, they start clicking around, and instead of necessarily needing to go and find themselves that particular link or that particular third party or that particular specialized service, they can just directly chat with a nurse, right? And those nurses are available digital first via chat. And those nurses, I mean, we have found probably the majority of the interactions, if our members do reach out to the nurse, can actually be resolved at that point. And what's interesting is we have this ecosystem of nurse services, medical services, specialized services, at-home services, mobile services that will come to your house. But it's very hard many times for our members to find them or to know what to ask for to be matched to them. And so this nurse human augmented digital chat first service allows to match them immediately, right? And so our member doesn't need the knowledge. They don't know to know exactly that we have this sort of library or set of services. And not only they will be educated in the moment with the information they need through chat, but that nurse will also immediately be able to link them to that site or potentially to set up an appointment and help them with it. And that's huge, right? It's sort of the best of digital and the best of a human, personal, empathetic interaction that is deeply expert in a service. And net for the member, they don't need to know. They don't need to have the expertise. They don't need to educate themselves that much. At the point of engagement, unfortunately, when we need healthcare, it's the worst time to educate yourself, right? On what's available to you or what your benefits are or what the cost implications are. And this digital access enabled by nurses is really a big deal.
Love that. Incidentally, folks, by this time you have a feedback form or a Survey Monkey link in your inbox. It's going to take 2 to 3 minutes to complete for us. And anyone that completes it, we will send them my unabridged notes. Don't think they're going to be like neat and tidy, but all my notes have been taken in preparation for the show. And as a byproduct of what people are saying on the show right now, you'll get those. If you haven't been taking good notes, you'll get mine as a thank you for completing that survey. Rita, someone you work with multiple plans across the country. I guess I have a two-part question for you because I'm trying to get some audience questions integrated into this too. So one, you work with multiple plans. So what do you see as the next generation of personalized navigation in healthcare? And then maybe you could outline for us, if someone wants to know sort of how health plans in general are standing up these personalization initiatives. So I'm wondering maybe if you could share with us quickly, if you take all the health plans you've been working with, like what are some of the common characteristics that are making those personalization and member experience initiatives so successful?
So I think when I look across the plans, the consistent themes are, gaps in care, the need to close them. There's operational inefficiencies, and then across the board, this poor members' satisfaction or dissatisfaction. So what I'm seeing with many of the plans is they're improving the health outcomes by providing better treatment compliance, closing gaps in care. And so they're doing that in terms of making sure that the utilization is being driven away from high cost care to care settings, such as away from ED and urgent care to other care settings. And so Laurent just talked about one of those patterns is how can we get people access very quickly within 30 seconds to a healthcare professional so that we can get that resolution and we can get it right there for the patient from their home, from their offices, whatever that looks like. So again, driving people away from ED and urgent care. And this is a big initiative that I'm seeing across the board. And then I think the other way that everyone's approaching it, or the cutting edge folks are approaching it, is enhancing that member satisfaction by offering a personalized and super convenient member experience. And so what I'm seeing is that there's an investment in process, in people, and best-in-class technology partners. And they're finding the issues, and then they're directly addressing them, and then they're getting the results. That's been my observation so far. And I think it's been exciting to see the level of innovation within health plans to create this next generation experience for their members and actually for their employees too, which has been a great focus. When we talk about operational efficiencies, there's humans behind some of that efficiency. And I think, how do we help our healthcare professionals be more productive? And so I think there's a huge role for AI in being able to do that, whether that's decision support or through the acceleration of triage, which is some of the ways that Pager Health uses AI. But I think there's a way to embed all of that to achieve those operational efficiencies and productivity, satisfaction also at the employee level.
So 3 common challenges, which I don't think is going to be breaking news for anyone listening: gaps in care, operational inefficiencies, and member dissatisfaction. And what you just outlined is sort of what you're seeing with those, the successful stories you've shared with us, is they've all had a focus on digital navigation and driving individuals away from urgent care and EDs. They've all invested in the process changes in people to focus on those challenges. And they've created personalization through personalization, they've created efficiencies, some of them leveraging AI to triage more effectively. And then the third thing you said is a lot of them are finding third-party partners to support through technology and AI, so they're not necessarily doing it on their own.
Yeah, that's right. That's right, Eric. And I think one of the things that I'm going to note is that sometimes people go through a linear process, or organization goes through a linear process. The companies that I'm finding are the most successful in achieving these results are the ones that looked at it very strategically and placed the right bets across the board around process and people and technology.
Great. It probably helps to have that like consumer-centric culture that Laurent spoke about earlier. Sherri, I didn't know if we were going to have time for this, but I think like, Rita teed us up, so I want to get into it. How are you thinking about generative AI to the future of BlueCross BlueShield of Tennessee's personalization strategy?
Yeah, I think there's a couple of things. I think it's going to give us a lot more insights into unstructured data and what are those components that's going to tell us about a member that we don't know, and how we feed that in to some of our existing scoring algorithms, et cetera. But I think where it's really going to help us is with content generation. When we think about a personalized journey, it takes a kind of an army of people to try to pull together, how you want to communicate with an individual, that next best action that needs to be taken. And I think generative AI has the potential to help us get much better at that much faster and create that personalized experience, whether it's content, whether it's that next best action, whether it's a web app looking differently for a particular individual as they log in. I think there's lots of potential there when we think about that technology and how we might leverage it in the future.
So two big areas where you guys are exploring, tell me if I'm putting words in your mouth, exploring, using AI to provide better insights into unstructured data, and then using AI to personalize the content so that you could really on an individual level send content that's customized for, let's say, Eric Glazer specifically.
Exactly.
Like that. No, we talked earlier, or you talked earlier about impactability scores and combining this with social and clinical risk scores as a way to identify, as you called it, I don't know if you, next best action. And I'm curious, what other commercial and operational, benefits you guys are realizing as you're going down this road of digital personalization. Has there been some residual benefits that you guys have realized? Because I just want to provide inspiration for those of you listening. I'm sure everyone listening has done this to some extent, but I want to provide inspiration and ideas for folks that are like, hey, I'm going to create a business case or a summary for my CEO or Chief X to sort of take us to the next level. So I'm curious what other residual benefits Tennessee has benefited or realized.
Yeah, I'll probably just highlight 3 areas. One is, new products and services. So around consumer advocacy and how we might help someone navigate through the system. So I think having access to this type of information across the continuum, whether it's our provider, our consumer, our clinical person that's engaging, we can help that member navigate. And so an opportunity to really create those advocacy programs for our members. The second one is really a way to personalize an experience. So for example, we had a customer who has a really big problem with emergency room visits, and we've tried a lot of different scenarios to kind of move the needle on alleviating some of that. And a lot of the approach that we took before was, it was kind of a generality of, okay, let's send out a mailing, let's send out a call, etc. And what we were able to do with the technology and the fact that we have all this information is we were able to run multiple campaigns based on that person's impactability score, their social risk factors, the communities they lived in. And we were able to personalize those outreach strategies to those particular individuals. And what we found was that we saw a much better uptick in our ability to redirect someone, let's say to telehealth, or redirect them to to their primary care physician. And it was interesting as we went through that, we were learning things as to why people might not want to go to their primary care doctor, why they would elect to go to the emergency room. And some of that had to do with financial stability and the fact that they maybe owed their provider money and they could go to the ER for free. So that kind of came out of that scenario and really understanding that. And then I think the other thing that helped us with is really understanding that after about 6 months, we had to re-engage with those members, because after 6 months, we started to see the behavior shift again. And so that was another area. And then the third area is really kind of back to what Laurent said, and basically knowing that these folks really live in a community. So understanding the social risk factors and the social risk index score. For example, one of them that we see across the state of Tennessee is food insecurity. And it's not necessarily that they don't have access to food in general, but they don't have access to healthy food. And that makes a big difference. If you're a diabetic, you need to have access to that healthy food. And so one of the things that's allowed us to do is, for example, we've supported and maintained these food gardens in certain communities where we have actually planted food in those areas, and we're maintaining those gardens where we're working with, some other community resources to supply fresh produce to those members. So again, I think being able to really hone in on what's needed in a community is really going to increase this personalization and individualized experience with the people who live there.
So the overall consumer advocacy you're been able to improve because of it. I heard 3 residual benefits, but I might have missed some. So Sherri, keep me honest. One, you understood better why like a consumer was avoiding the doctor. Oh, they owed that doctor money, cheaper for them to go to the ER.
Right.
2, hey, after 6 months, we need to be re-engaging them. And 3, hey, people are part of a community and there are a lot of social risks that we need to fundamentally understand, not just food deserts, but maybe they have access to food, but not like healthy food. And so now you're maintaining food gardens around the state. That's what I heard. It also allows you to have a much better effectiveness in your campaigns as you're just in general recustomizing your marketing or engagement campaigns.
Exactly.
It's great. I love that. There's a few of you had mentioned, and I'll bring in Laurent. We'll start with you, and then maybe we'll bring back Victoria too, because I think you answered it, but I want to answer it for everyone. A lot of people are talking about bringing in third-party platform companies. Laurent, what are some of the things you're looking for when you're looking for like a partner to do something like this?
Well, number one, I mean, is a shared commitment to our mission of serving the individual, right? Number 2, I think there's a technical dimension about being able to integrate shared data in ways that are simple, contemporary, based on open standards, and of course, assuring the security and the privacy of the individual. As I mentioned earlier, the key to this is not only the ability to deliver on certain services and ensure that the value is there, and the ability to integrate, into our backends, into our digital experiences and human experiences is critical. Otherwise, we can't deliver and scale the service. The other element is an ability to collaborate and partner with that third party so that we can design and optimize the member experience or the patient experience in such a way that it is intuitive, that it is easy, and that has as little as friction as possible, as Victoria mentioned, to minimize the abandonment rate. What's interesting to me, I think about technology. I mean, I'm a technologist. I love it. Sherri mentioned Gen AI and AI, which we are so excited about it. We're very optimistic. Kind of reminds me, and this relates to your question, is what are we trying to solve here, right? I mean, it's easy to get overwhelmed with laundry lists of services and technologies and capabilities. And it reminds me, as I think about what do we want, and I was listening to a podcast the other day, an interview of Howard Schultz, the Starbucks founder.
I listened to that.
And he was talking about, one of the quotes that I took down is like, says, with scale and efficiency, the touch point with a customer needs to be elevated. And what he was highlighting, and he was a little bit sort of saddened a little bit about how much technology had reduced the experience of the customer in the context of a Starbucks visit. And then he finished by a theme that I think applies to healthcare really well. scaling the humanity, and humanity is the product, right? Which I think is what all of us on this panel have talked about, right? We talk about data, we talk about integrations, we talk about APIs, we talk about digital health, we talk about closed loop processes, referrals, guidance, but really ultimately it's all about scaling the humanity and making healthcare more human, not less human. And I think as we think about third parties, they need to help us achieve that, I guess, would be the place I would focus on.
Great way to end. By the way, the podcast is called Acquired. I will put the link to that episode. That's a great call out. That was a great episode. Love Howard Schultz too. We'll put that link into the show notes. I want to thank you all for the work you did to prepare for this and to participate today. This was awesome. To all of you listening and watching, we do not take the time that you spend with us for granted. We work hard to make sure we bring guests to you each and every episode to provide you ideas, insights, and bright spots. We hope you use some of the bright spots shared today to inspire your thinking and enhance your organization's current approach to improving healthcare for all of us. Thank you to Pager Health for supporting this episode. We produce this show for all of you listening. And remember, this is your Bright Spots in Healthcare podcast. Take care.